Hi students, do you remember what we learnt in the last class about iron? Yes, we learnt about absorption and metabolism of iron in the last class. Today in this class, we will learn about iron itself, but about the sources of iron, requirements and the toxicity of iron. I think you would have understood and you still remember that every living cell in our body has iron as a trace mineral. It is a primary component of two proteins, that is the hemoglobin and myoglobin. You know, hemoglobin is the part of the red blood cell which carries blood to the body's tissues. Myoglobin is the part of the muscle cells that hold oxygen. The most common form of nutritional deficiency of iron is the iron deficiency. According to the Centers for Disease Control and Prevention, the best way to ensure that you are not deficient in this important nutrient is to consume adequate amounts of iron-rich foods every day. And do you know what are all the best iron-rich foods? The best iron-rich foods include all the green leafy vegetables, liver, grass-fed beef, lentils, yes, also the dark chocolate which you all enjoy, sardines, black beans, pistachios and raisins. Now coming to the objectives of this session, you will be able to understand the food sources of iron, gain knowledge about the ICMR recommended requirements of iron for various age groups, identify the signs and symptoms of iron deficiency in human body, and have an insight about the excess intake and accumulation of iron in the body. Students, do you know that whether you are getting sufficient iron-rich foods in your daily diet? What are all the iron-rich foods? I am now going to reveal to you the healthy iron-rich foods, which includes the meat, fish, beans, green leafy vegetables, dry nuts and some fruits. Here I am going to list out some iron-rich foods. First one is the spirulina. 1 ounce of spirulina will provide with 8 milligrams of iron, or it may give about 44% of daily value of iron. This spirulina is nothing but a blue-green algae which is known for its intense flavor and for the powerful nutrition profile. 1 ounce of spirulina will provide almost half of daily iron requirements. Suppose you are a vegetarian, then spirulina will be the best source not only for iron but also for all the essential amino acids, proteins, the vitamin B, C, D and E. Next is the liver, and especially liver of organic beef provides with 4.05 milligrams of iron. When it comes to foods with heme iron, liver only tops the list. In case of any type of anemia, which is nothing but a symptom of iron deficiency, liver will be the best food to consume because it not only contains iron but it also contains folate and vitamin B12, and these two vitamins are essential for absorption of iron in our body. Third one is the grass-fed beef. Grass-fed beef is also another good meat source of heme iron, and it also has many other essential nutrients. In addition to iron, it is also high in precursor for vitamin A and E, along with antioxidants that fight against cancer when it is compared to grain-fed beef. The next one is the lentils. They are nothing but legumes which contains impressive amount of non-heme iron per serving. Apart from their high supply of nutrients, the important benefit of this protein-packed lentils in the diet regularly is it is very cheap and it is versatile and available always. The next is the dark chocolate, which each and every one of us will enjoy eating. This dark chocolate, 1 ounce of dark chocolate gives 3.3 milligrams of iron. So when you buy high quality dark chocolate, you not only satisfy your sweet tooth, but also it gives your body a significant amount of iron. So what you need to do is to consume 1 ounce to fulfill almost 20% of the daily iron requirement, and it can also be considered as a healthy dessert option. Next one is the spinach. This spinach is loaded with iron as well as many other essential nutrients. It is one of the good vegetable sources of iron. Spinach is delicious either in the raw form or cooked form. When it is cooked, you tend to eat more, which means even more iron you get per spoon of the spinach. Next, there comes the sardines. The sardines, quarter cup gives you 1.8 milligrams of iron. The sardines are probably the best known for their high concentration of omega-3 fatty acids and vitamin D, and also there is significant source of heme iron. This sardine, it is very easy to find everywhere at affordable price, and hence it can be used in many preparations. Black beans, a vegetarian source which provides half a cup of it provides 1.8 milligrams. This is rich in iron, protein and fiber. This black beans provide time-released energy in the form of starches, making them an excellent carbohydrate source for anyone who is insulin resistant, like if they are pre-diabetic or those who have diabetes. The pistachios or the nuts, 1 ounce of this will provide 1.1 milligram of iron. This is a healthy snack idea for weight loss and weight control. Just 1 ounce or 49 kernels provides you with iron with high levels of vitamin B6, thiamine and copper. So pistachios are one of the best sources of iron. Next is the raisins or the dried fruit. Quarter cup of raisins will give 1.1 milligram, and these dried fruits are rich in iron, and this can be added in yogurt, salads or in any other dish. And vitamin C in raisins helps in the absorption of iron also. Next one is the Brussels sprouts. It contains vitamins, folate, fiber, iron and other nutrients and protects from anemia. Soya beans is the next best source of iron, proteins, fiber and unsaturated fat. Boil 1 cup of soya bean and consume every day. It helps in muscle development and also increases in development of RBC. Next is the brown rice, which contains fiber and iron. It helps in flushing out the toxins from the body and it prevents fatigue and anemia. Next, broccoli, which is a vegetable with a great source of iron and vitamin C, and you know vitamin C helps in iron absorption. Kale is another food which has a high amount of iron and it is also fat-free food. It can be added in sandwiches and other dishes. Potatoes, it is rich in iron and vitamin C, but the intake should be in moderate amount. The oatmeal, which helps in reducing iron deficiency, has high calories and it is also high in nutritive value, and it is a good source for maintaining the body weight. Next is the red kidney beans, and this contains, or half a cup of red beans contain 2.6 milligram of iron. Dried peaches contains 1.6 milligram of iron in quarter cup of dried peaches. Pumpkin seeds is also a good source, as 1 ounce of pumpkin seed contain 1 milligram of iron. The fermented soya product, that is the tofu, contains 3.4 milligram of iron. And the other sources which are rich in iron includes the prunes and the figs. Students, it is estimated worldwide that around 80% of the population may be deficient in iron and 30% of them have iron deficiency anemia. So consuming iron rich foods is especially important for premenopausal women who have higher iron needs than men due to monthly blood losses. And if you are deficient in iron, it is also necessary to get plenty of vitamin C in diet along with iron because it helps in iron absorption. The recommended dietary allowance for iron is 8 milligrams per day for men and older women, while premenopausal women need 18 milligrams per day. The RDAs for vegetarians is 1.8 times higher than meat eaters due to the fact that meat's heme iron is more bioavailable than non-heme iron from plant-based foods. Now let us have some recapturing about iron-rich foods. Iron deficiency can be avoided by ensuring to eat iron-rich foods on a daily basis. Sometimes iron supplements may be necessary, but increasing your dietary intake of foods rich in iron is the natural and safe way to improve the iron levels. Along with preventing anemia and reducing iron deficiency, benefits of consuming iron-rich foods include increased energy level, better muscle and brain functioning, and also iron is vital for healthy pregnancy and can help treat restless leg syndrome. Next, we will look into the requirement of such an important micro mineral. The requirement of iron for different groups is derived based on the basal iron loss and additional requirements for blood volume expansion in pregnant women, for conversion of milk in lactating mother, menstrual loss and skeletal growth in children are all accounted. Basal loss is the iron requirement for an adult equivalent to the iron sufficient to replace the daily losses. An adult weighing 60 kg has around 14 microgram per kg body weight of basal loss of iron per day. Hence, this individual will require 0.84 milligram of iron per day. An adult woman, the requirement, if she is weighing 55 kg, suppose if she is a premenopausal woman, the basal loss is 14 microgram per kg body weight, and iron needs to replace blood loss through menstruation. Considering the loss due to menstruation and the basal loss, an adult woman would require 1.65 milligram per day. Next is the iron requirement during pregnancy. You know, during pregnancy, iron is needed for fetal growth, for the blood loss during parturition, and also for the expansion of the maternal tissue. Taking all these consideration, a total of 760 milligram of iron is required totally during the 3 trimester of pregnancy. Requirement of iron during lactation, and here iron is required for the mother to convert the blood into breast milk. So summing up these requirements, it will contribute to the total amount of iron requirement. Therefore, the iron required during lactation is about 1.27 milligram per day. Coming to the requirement for infants and children, particularly at a high risk of iron deficiency because they have large demand for iron during the period of rapid growth and also due to their diets which is low in ICMR. This table presents you the ICMR recommended dietary allowances of iron per day. So you can look into this table and understand what is the requirement, and you can try to follow or suggest anybody if they ask you. Next, students, after learning the sources and the requirements, we are going to learn about the toxicity of iron. What is the definition for toxicity of iron? It is nothing but there is too much iron in the body. For example, the excess iron, it is in a bio-unavailable form such as an oxide form. In other words, there is not much available iron. Instead, toxic forms of iron will be building up in the body. This condition is acquired, and also it can be due to genetic susceptibility or maybe due to other factors such as eating too much red meat or eggs or taking iron rich pills. Danger of consuming iron pills is that if you are consuming it for more than a month, it is very dangerous. That is why women are advised not to stay on prenatal vitamins which contain a lot of iron after delivery. And this iron toxicity is very common, and though it is a vital mineral in the human body, once overloaded it is dangerous. So physicians believe it is rare, and also mainly it is a hereditary problem. We will just analyze whether it is a metabolic or a hereditary condition. Traditionally, iron toxicity was considered mainly a hereditary condition. Articles in the New England Journal of Medicine indicate that a person may have iron overload without having either the hemochromatosis gene or other obvious reasons for the problem, such as multiple blood transfusions or other obvious exposure. There is a problem in identifying this because all the standard blood tests will not exactly reveal it unless it is far advanced. As a result, doctors do not find it in most cases. Big problem with iron toxicity is that medical treatment for this toxicity is very crude, that is, blood has to be removed. This method is also harmful because removing blood causes not only loss of many nutrients, it will worsen malnutrition, which is very common among the population. A well-designed nutritional balancing program can reverse iron toxicity. This is true in some advanced cases of hemosiderosis and hemochromatosis. These two diseases are considered hereditary and incurable, but not always true. Now, we will look into the causes of iron toxicity. What are all the causes of iron toxicity? First one, it can be excess iron in the diet, or iron can be supplemented, or iron is present in water, or there is occupational exposure, or overabsorption of iron from the diet. Also, along with that, there will be difficulty in eliminating enough iron from the body due to physical or other mental factors. Also, enriching food makes the situation worse. In many cases, it will contribute to diabetes, heart disease and cancer. The reasons are enrichment will improve the iron content, and therefore it will increase the iron in the diet. The iron is enriched in the form of sulfate, iron fumarate or sodium iron EDTA. These can easily be changed into a toxic form of iron such as an oxide. The body requires minerals and will absorb water, whatever is available. White flour is mainly removed of its trace element, creating a nutritionally deficient food. The iron is plentiful, thus the body absorbs more of it than it would if there were a natural balance of minerals in the flour. And iron is selectively absorbed by the body because there is a survival mechanism, because iron is required for oxygen transport in the blood. After learning about the sources, requirements and the toxicity, we are now going to learn about the deficiency of iron. You know that iron is an important mineral which is required for maintaining a very good health and well-being of an individual. If there is any deficiency, it will affect many body functions. You know that the most important role of iron is to carry oxygen in the blood to every cell in the body. Iron is an important component of hemoglobin, the protein in red blood cells which carries oxygen from the lungs and delivers it throughout the body. So, if there is an iron deficient condition in the body cannot produce enough healthy oxygen carrying red blood cells. Therefore, iron deficiency will cause anemia, which is nothing but less hemoglobin in the blood. Women who are pregnant need the most amount of iron because the baby will act as a parasite and absorb the iron, and the woman increases her blood volume to circulate through the baby and create the baby's blood volume. We will now look into the various signs and symptoms of iron deficiency. The first one is if you are deficient in iron, there will be a condition of extreme fatigue and exhaustions. This is a principal sign that shows that body is not getting enough oxygen. It means body is having trouble carrying the oxygen to the cells, so it is affecting the energy levels. Iron deficient person often feel sluggish, weak, and they are unable to focus in any work. If fatigue does not go away with adequate rest, then the iron levels should be first checked. Next is the frequent infections. If there is iron deficiency, the individual will have infections because iron is important for a healthy immune system. Lower levels of iron can make the person susceptible to infections. Red blood cells help to transport oxygen to the spleen, which is one place where infections can be vanished off. Red blood cells also carry oxygen to the lymph nodes, which is a house of infection fighting white blood cells. During iron deficiency, the white blood cells will not be sufficiently produced. The next symptom is a very pale skin. Hemoglobin in the blood will give the skin its rosy color, but reduced levels will make the skin lighter. The RBC with low iron content will become very small and paler in the center, and hence the skin also becomes paler. This may be easier to detect in people with lighter complexions, but whatever be the skin tone, if the area inside the bottom eyelid is lighter than normal, then this is a sign of iron deficiency. The next one is the swollen tongue. Lack of oxygen makes the muscles large and painful. This happens to all the muscles, but it is clearly visible on the tongue only. The next is a condition called pica. Iron deficiency will develop cravings for non-food substances such as clay, dirt or chalk, a condition known as pica. These substances will interfere with absorption of iron. Next symptom is hair loss. Anemia can cause hair loss. When hair follicles don't get enough oxygen, they go into a resting stage and hair falls out, and it does not grow back until anemia is treated. It is normal to lose about 100 strands of hair per day. However, if the hair loss is excessive and it is not growing back, this may be a sign of iron deficiency. The next important symptom of iron deficiency is the commonly called term anemia. This anemia itself is having separately signs and symptoms. So the signs and symptoms of anemia are extreme fatigue, weakness, pale skin, chest pain, fast heartbeat or shortness of breath, headache, dizziness or lightheadedness, cold hands and feet. Next is inflammation or soreness of tongue, brittle nails, unusual cravings for non-nutritive substances such as ice, dirt or starch. Poor appetite, especially in infants and children, is also present. We will now look into the causes of anemia. The first cause is loss of blood. Blood contains iron within RBC. So, if blood is lost, it will lead to iron loss also. Women with heavy periods are a risk factor for iron deficiency anemia because they lose blood during menstruation. Slow, chronic blood loss within the body, such as in the condition of peptic ulcer or a colon polyp or colorectal cancer, it will cause iron deficiency anemia. Not only that, loss of blood, but also lack of iron in diet will cause anemia. Body regularly gets iron from the foods. If the consumption is too little, then over time the body can become iron deficient. Next, if iron is not absorbed properly, then it leads to anemia. Iron from food is absorbed into the bloodstream in the small intestine. An intestinal disorder such as celiac disease affects the intestine's ability to absorb nutrients from digested food, which leads to iron deficiency anemia. Next is the pregnancy condition. If iron is not supplemented during pregnancy, then anemia will occur in pregnant women because she needs to increase her iron stores to serve not only for her but also to increase the blood volume in the growing fetus. The following groups of people have an increased risk of iron deficiency anemia. Can you tell who are all most affected by anemia? Yes, women, infants and children, and vegetarians as well as frequent blood donors are affected by anemia. If this anemia is left untreated, it will become severe and it will lead to the following health problems. Now we will look into what are all the health problems caused due to iron deficiency. So first, heart problems. Iron deficiency causes a rapid or irregular heartbeat. Heart must pump more blood to compensate for the lack of oxygen carried in blood, leading to an enlarged heart or heart failure. Next, in pregnancy. In pregnant women, severe iron deficiency anemia will lead to premature births and low birth weight babies. This can be prevented by taking iron supplements. Next, the growth problems in infants and children. Severe iron deficiency will cause delayed growth and development. Additionally, it is also associated with increased susceptibility to infections. So, students, now learning about the effects of iron deficiency, we are now going to sum up and see how to prevent this iron deficiency symptoms. A healthy diet including all the good sources of iron as described earlier, including fruits, vegetables, whole grains, fat-free or non-fat milk and milk products, lean meats, fish, dry beans, eggs and nuts will give sufficient iron in the diet. Also, taking the above foods, diet also should include foods that will help in absorbing iron better. So, which nutrient helps in iron absorption? Yes, vitamin C will help in absorbing iron. So, the diet should contain foods which are rich in vitamin C also, which will help in absorbing the non-heme iron foods along with the heme rich foods also. We are now going to sum up and see how to prevent this iron deficiency symptoms. A healthy diet including all the good sources of iron as described earlier, including fruits, vegetables, whole grains, fat-free or non-fat milk and milk products, lean meats, fish, dry beans, eggs and nuts will give sufficient iron in the diet. Also, taking the above foods, diet also should include foods that will help in absorbing iron better. So, which nutrient helps in iron absorption? Yes, vitamin C will help in absorbing iron. So, the diet should contain foods which are rich in vitamin C also, which will help in absorbing the non-heme iron foods along with the heme rich foods also.